Yes, hello everyone. I'm Olivia Malvasi, and I am the group facilitator for the Central and Capital Region. Our next slide will show everyone in our group. Go to the next slide, please. All the students have done a really great job this summer. They've put in a lot of work. They're going to introduce themselves as they present, and we wanted to thank all of the legislators from our region that are attending and other attendees that are here today. And we hope you enjoyed the presentation.
Hi, I'm Olivia. I'm from New York City and I'm a rising junior at College of the Holy Cross. So in the capital region during the week of June 17th, many schools had to dismiss early due to extreme heat. There were highs of 97 degrees with a heat index of up to 104 degrees. Some school districts expressed the concern that in heat like this, students should not be outside for more than even 15 minutes. This also brings up the problem of air conditioning in schools because in Albany, for example, even though all schools have air conditioning, it does not always work. Despite this, Regents exams were still held, with only some exams being given in air-conditioned spaces. Uh, so when we think about why this extreme heat is happening, we have to look at climate change. Some causes of climate change are generating power by burning fossil fuels, cutting down forests, transportation that runs on fossil fuels, emissions from food production, and overconsumption. This is important because one major effect of climate change is hotter temperatures. This is because the rise of greenhouse gas concentrations causes the rise of global surface temperature. As you could see a little bit about how this happens in the image in the corner, it shows how the energy from the sun that warms the earth gets trapped by greenhouse gases.
Hi, I'm Sophie. I'm a rising senior at Geneva High School, and we wanted to focus more specifically on Albany just to kind of demonstrate. You can see in the upper left graph that we've already experienced, especially in the summer, a big temperature increase from 1970 up till 2022. And you can see in our other graph here that it's not just isolated to summer temperatures. We're seeing it across all the seasons, which is indicative of greater warming in general. And then the bottom graph here, you can kind of see how carbon dioxide in the atmosphere has kind of fluctuated for a very, very long time. And then from 1950 on, we've had this huge, huge spike that is contributing to the heat that gets trapped in and that global warming. Next slide, please. Okay, and then continuing on with Albany, we know that these temperatures are going to continue to rise even if we stopped all of our harmful behavior now. And you can kind of see across time here how some of these higher temperature days, the hotter they are, the more health impacts they have. And you can see how many days we have now and then our predictions. Over on the bottom right here, you can see how 30 years ago, we had a very limited number of those above 100 degrees Fahrenheit days, and how this year and then going into, again, 30 years ahead, it's increased. It's predicted to have a large increase, and that's going to come with a lot of health impacts as well and strain on these central and capital regions of New York.
Hi, my name is Noor Naeem, and I'm a second-year medical student at New York Medical College. Next slide, please. So extreme heat is very important because it affects our health at every stage of life. During neonatal and early childhood development, rising summer temperatures have been linked to an increase in congenital cataracts in the New York State. Cataracts basically cloud the eyes and impair vision, and these can develop because heat can act as a teratogen, which is basically a factor that can cause malformations. Continuing to during childhood, the usually in predominantly Black communities, they often face poorer housing conditions in urban areas. And because of that, they experience higher rates of asthmatic exacerbations. The adverse effects of substandard housing are exacerbated by extreme heat specifically, and that puts them at significant health risk. Additionally, there's an increase in the risk of injuries because As the temperature gets warmer, children are spending more time outside, and that leads to a higher likelihood of unintentional injuries. There's also been an association between elevated temperatures and increased aggressive behavior, and that contributes to an increased risk of intentional injuries as well. In adolescents and young adults, especially with those with pre-existing mental health conditions, they also get severely impacted by extreme heat. Research has found that there's a positive correlation between mental health related emergency room visits and days that have elevated temperatures, again, particularly in vulnerable communities such as Black and Hispanic communities. Older adults are also not spared from the effects of extreme heat. On extremely hot days in New York State, research has found that there is an increased risk between cardiovascular disease-related emergency room visits in older adults. Specifically, this includes an increased risk of ischemia, hypertension, and dysrhythmias. So it's basically evident that extreme heat isn't just a problem for one specific group, rather it's a pervasive problem that affects basically everyone. Next slide, please.
Hi, my name is Claire, and I'm a second-year medical student at SUNY Upstate University. And in order to discuss the interventions that we wanted to look at, and which areas, in order to discuss interventions we wanted to look at, which areas in our large and very diverse region were the most vulnerable to extreme heat effects, we found that heat vulnerability was more observed in urban areas due to infrastructure that reduces open vegetative space and instead opts for surfaces that retain heat, such as pavement. In addition, we noted that in rural areas, elderly populations are more vulnerable due to lack of access to healthcare and social isolation. So we decided to focus on the Onondaga and Albany counties since they showed increased vulnerability, had increased pediatric populations, and should be an area of focus for interventions because of these reduced vegetative spaces. Next slide, please. We looked at this map of the entire state to see the increased heat vulnerability in many areas throughout the Central and Capital Region. And we zoomed in on a few specific areas of our region so we could further discuss how these counties are vulnerable. Next slide, please.
Hi, I'm Audrey. I'm an incoming student at the School of Public Health for a Master's in Public Health program in the fall. So building on what Claire just talked about, this is the New York State created a heat vulnerability index that has kind of 4 large categories. There's multiple factors that go into each, but they used language vulnerability, socioeconomic vulnerability, environmental and urban vulnerability, elder isolation, and elderly vulnerability to kind of get these numbers. So the darker blue is showing higher vulnerability. So as we can see, there's areas in Onondaga County, Albany County. And then we also took a look at Jefferson County because we have a pretty large range in our area and wanted to look at maybe a slightly more rural county. And there's definitely still some level of vulnerability there as well. Next slide, please. Here we've taken hospital rates of hospitalization and ED visits for heat-related illness. So on the bottom it shows the month, and on the side it shows rate per 100,000 people. So we're looking at Albany County, Onondaga County, Jefferson County, and St. Lawrence County. And as you can see, the numbers are somewhat similar in each county, but they definitely have some increases along the way. This data only goes up till 2016, so I would imagine if we look at 2016 to 2024, we would see more increases as well. Next slide, please. So then we were able to map out asthma rates. So the dark red is like high rates of asthma. And as we know, asthma is exacerbated by extreme heat. And then I was able to overlay that with the green dots, which are public housing developments. So as we can see, those areas of really high asthma rates directly overlap with the public housing areas. And just to show that like, that's just one of many vulnerable groups that's impacted by extreme heat. Next slide, please. And then we couldn't do the same thing in Syracuse and see the exact same pattern. Okay, and then next slide, please. So this is Watertown, which is a slightly more rural area. So we can see there's some overlap. It's slightly different, but the same pattern still kind of pertains. Next slide, please.
Hi, my name is Erica Hernandez. I live in Long Island and I'm a high school student. Next slide, please. So on these next few slides, we'll be talking about some strategies on how we can help prevent this extreme heat. So one way we can help prevent from this extreme heat is planting trees. So urban tree planting is essential in reducing extreme heat in our neighborhoods. Trees provide natural shade, which helps to cool down surfaces like sidewalks, roads, and buildings that absorb heat during the day. This reduces the urban heat island effect, where urban areas become significantly warmer than their surroundings. So trees release moisture through a process called transpiration, which cools the surrounding air. This process not only helps to lower temperature locally, but also improves overall air quality by filtering out pollutants and capturing carbon dioxide. So our next steps will be to collaborate closely with local schools, community organizations, and business to strategically plant trees in areas that experience high temperatures. By strategically planting trees, we can create cooler, more comfortable outdoor spaces for residents or really anyone, reduce energy costs associated with air conditioning, and enhance the overall livability of our city. Next slide.
Hi, my name's Grace. I'm a second-year medical student at the Jacobs School of Medicine in Buffalo. And kind of going off of increasing urban tree planting, another way we can mitigate the urban heat island effect is just increasing larger urban green spaces to kind of break up the large buildings and roads, which are absorbing all the sun's heat and re-emitting it back out, which is causing the urban heat island effect. So for this, what we can do is prioritize vacant lot space to be used for urban green spaces like parks. We can also utilize rooftop spaces for rooftop greenery and rooftop gardens, as well as, like Erica mentioned, planting trees along sidewalks and roads. Next slide, please. And then another way that we can kind of mitigate the effects of extreme heat is through cool roof initiatives. So traditional black asphalt roofs that are on, schools, hospitals, community buildings, they can reach up to 190 degrees Fahrenheit on a hot day. But installing a white reflective rooftop can actually reduce the internal building temperature by up to 30%, as well as save on 10 to 30% of air conditioning costs. So an initiative is being done in New York City called the New York City Cool Roofs Project, and that's part of the city's goal of reducing carbon emissions by 2050. So for our Now What, we can bring a similar initiative to areas like Syracuse and Albany to place these roofs on schools and community centers to help residents and reduce the effects of extreme heat. Next slide.
So just to sum things up, extreme heat significantly impacts health, and as temperatures continue to rise, so will these exacerbations. These exacerbations include early school dismissals, increased congenital defects, worsening asthma exacerbations, increased injuries, mental health emergencies, risk of cardiovascular disease, and more, with the risk being even higher in vulnerable communities. So now what? To curb these impacts, we're asking you to invest in urban tree planting initiatives, implement cool roofs in schools and housing, as seen in Syracuse and Albany, and to continue to advocate for climate change, because if we don't take action, things will only get worse from here.
Okay, thank you so much. We had a number of comments and questions coming in the chat. A lot of compliments on your excellent use of maps. And I think it's really a testimony to all the great data that's available from the state. And I'm so glad that you all learned how to access that. There is a question from Lisa Lawrence. And the question is, are there specific environmental issues in those mapped areas with high percentages of asthma? Heat makes asthma worse, but is there something in the environment causing it in the first place? Great question. Does anyone from your group want to take that?
I could talk a little bit about, I'm from Albany, so I'm a little more familiar with that area. Like There's one neighborhood in Albany that I think is included in that map, the South End, that it's kind of right underneath the highway of 787. The Port of Albany is there, and the state actually has done some different studies looking at like what the traffic is there because of the really poor air quality in that area. And they've just found there's like a ton of local traffic with trucks and buses coming through. And I think that's definitely impacting health in that area. I'm not as versed on Syracuse or those areas, so maybe someone else could add in if they know more about those.
I'm happy to chime in as an asthma specialist. I think that it's multifactorial and really like a chicken and egg. Extreme heat or any extremes of weather, so hot, humid air can absolutely trigger the airways and make asthma worse. But I think what we're seeing as we look at these maps is that children who live in these areas of extreme heat have a lot of exposures. And so it's multifactorial. We know that many of those exposures, such as traffic-related air pollution, living in homes that have poor ventilation, and so they trap more heat, those can all be risk factors for asthma. So it definitely compounds and can be a trigger for acute asthma exacerbations. But from a prevention standpoint, it can also be causative in a child developing asthma. So definitely see it on both ends. Thank you for that great question.
Okay, thanks so much. There was also a link added from our scholar, Kelly Galloway, with the Albany group, who has added a great example of the community calling for action and working with the state to identify risks and concerns in the Albany South End community. So you can learn more about those health concerns in the Albany region. So with that, we will now pass the mic over to the Hudson Valley region, who will be presenting findings about extreme heat in the Hudson Valley.